Aye.
Aye.
Opposed, same motion. Minutes are approved. And we'll be able to get right to number 3, the legislative updates. And I guess this session, we've had a lot of folks watching this year. We're anxious to get your take on it, Senator Lee.
Well, and I visited briefly with Representative Mitskock, and she was going to try to hop on, and I said, that's just fine. You take care of the business you're involved with there, and I think I can make this work out okay. So anyway, and if you have questions along the way, please let me know. I don't want to have this taking too long. But uh, the Human Services Committee in the Senate heard 72 bills in our House and then 53 from the House. So a total of 125 bills were heard and acted on during the legislative session, which I think is, if it's not the heaviest number of bills, we are quite sure that we have the heaviest content. So anyway, it was a busy group. So I'm only going to really focus on the ones that are related to human services and healthcare, because we're not going to care about some of the other stuff so much. Or if you are, you can let me know what the questions are, and I'll try to get those answered for you. But one of my special favorites actually was on guardianships. And we're not talking about the personal guardianships where maybe somebody is helping Aunt Martha in the nursing home take care of paying her bills and stuff like that. It's a family or friend kind of thing. But these are the professional guardians. Excuse me. Who have been grossly underpaid for a very long time, $10 a day. And that's about half of what you get if you say you want fries with that by the hour. But anyway, Scott Bernstein has been wonderful as representing the Guardianship Association in sitting in on all of the committee hearings, because I had to be in my own. And so he was terrific about being in the appropriations and in the House policy committees as well to follow through on this whole thing. But we were looking for additional money for indigent and for individuals with developmental disabilities, because there is not only a tremendous need to have to raise this pay, but also we have waiting lists of people with guardianship needs. Senator Kristen Roars was telling about a man that was in Sanford Hospital, where she works here, for I think it was 320 days. It was over 300 anyway. And he was capable of leaving. However, they couldn't find a guardian for him. And one of the reasons was that he's apparently a difficult person, and so it would take someone with some special skills. But there's just such a tremendous shortage, well over 100 people waiting for guardianships. So instead of costing $10 a day, it was something like $3,200 a day to have him in the hospital, when he would have been better off also if he had had a guardian. So there will be some potential increase in pay. We were hoping to double it to 20, but it's not going to be quite that good. But anyhow, I was just going to read to you what the message was. I just got to go back to it here. Hang on a minute, because I asked him for the current absolute update on how this was. We had one bill. I sent it in with one bill. The first part of it was going to, oh, let me back up just a little bit. Judge Phelan had 2 years ago during the interim uh, asked a bunch of people who were stakeholders in this issue to get together and meet regularly to determine what the outcome would be to make professional guardianships more accountable. And Representative Robin Weiss and I were a part of that. Well, what she wanted and what ended up coming out of that group was another government commission. And I knew that that was not likely to sail easily through the legislature, and it didn't. So anyway, she did it again this summer, or this past interim, but Representative Weiss and I decided that it probably was going to have the same goal and just give another whack at it. And we thought maybe there's another way to do it. So here's a radical idea. I contacted the Guardian, and we had a great, and there was only one or two of them on that other task force. It was mostly people from the courts and law enforcement. So the Guardians and I met pretty regularly on Zoom. One day we had a meeting that was called, or I asked for a meeting if we could get together, and in 40 minutes we were all on a Zoom call. I think that's a miracle. But what we did was figure out what we have, what we need to do, and how it's going to, what will it take to get there. So they did a tremendous amount of work, and we're trying to think about how can we make this an accountable thing. I mean, there are good professional guardianships out there. There's no doubt about that. But you may have heard about one in the news a year or so ago that was egregiously bad and had been diverting assets of the ward to the guardian's personal accounts. And one part of it was making themselves beneficiaries on life insurance policies. And these people aren't all indigent. Some of them have a lot of assets. And in this particular case that was actually investigated by the courts, these insurance policies have been diverted, and some other assets may have been as well. But they also weren't paying any attention to what his personal care situation was. So when somebody finally went out to where he lived alone, he had no family and he had dementia and lots of land and plenty of money, but nobody to pay any attention to him. And his chest hair was growing through his t-shirt. So that's an egregious example of why we need to have some kind of accountability by professional guardians. Most of them are really good, but that outfit was not. And the way it was set up in the law, the only way that the courts could investigate is just that one circumstance. They were not able to look at all of the other guardianship contracts that organization had. So we were trying to figure out how we, in addition to the money and the number of guardians we need and all that kind of stuff, trying to figure out how best to have this accountability thing work. And Donna Bozeski from Catholic Charities had an inspired idea, and we talked about it, and it looked like a good one because the courts already has a guardianship monitoring committee or entity, but they don't have staff or the ability to really investigate. So we thought, here's the deal. We won't antagonize the courts by setting up something different. We can work with them on something that they've already got and enhance it with an investigator, which does need to be an attorney, and with funding to be able to follow through on some of these. And then there's a task force in this bill, 2345, I love the number, that will work together, stakeholders with various perspectives that will work together with that guardianship monitoring committee in the courts to establish the process. How are they going to make this accountable? What kinds of reports, quarterly, monthly, how do they cover the proper basis? So that task force will be active just really during the next interim, perhaps even less than that, to establish this procedure. And then the task force will go away and the guardianship monitoring committee will handle it. Sally Holowach from the courts, who unfortunately is retiring, and she's terrific. But she was very enthusiastic about this. And so that had $290,000 for an appropriation. And we did eventually get that. The governor signed it yesterday or today. So that was a goodie. But then this bill that I had so tidily put into one package ended up dividing into three because that one went to the court's budget. The next piece went to the Office of Management and Budget, which handles the money, the funding for individuals with the indigent guardianship. So that's where that money is. Now, OMB doesn't know anything about guardianship. They just handle the money. But the court determines to the guardian. And the last phase went to the Department of Health and Human Services because that's where the guardianships are for individuals with developmental disabilities. So they have, and it would have been so much easier to follow for everybody if they had left it in one budget or one bill, and then it could have been distributed among the budgets when they had reviewed everything. Because those folks who were on those budgets didn't know what the other ones were doing either. But we had a little glitch in the what it looked like a really good change in the system, and it was not a good change in the system. But ultimately, we were hoping for $8.1 million for these guardianships. We ended up getting $7.1 million, which is a lot better than the $2.4 million, which had been there for the last 2 years and which was in the governor's budget again. And I'm not blaming the governor; he just didn't know how much of a demand there really was here. So anyway, I'm really pleased about that. The task force has also passed now that small appropriation. And so it did end up getting accomplished. So thanks to the wonderful guardians who provide those services, and especially to Scott Bernstein, who was at the Capitol every day, and they were very engaged in putting this bill together. It's something that they know should work, and they are pretty excited about being able to get started on it. So that's one not big but good thing that came out of session. There's another bill 2029 that is training for community workers who are working with individuals with developmental disabilities. There is another one. I read my own penmanship here. Oh yeah, that is talking about the human services centers in the four, the eight that we have around the state. The eight human service centers will gradually be converted, all of them, to community behavioral health clinics, which is a kind of a new designation around the country, but it will allow 24/7 access to care, and there will be behavioral health specialists available. So that there are two of them to start with, because it's going to take some time to get the process in place. And once it's gotten started with two, then it won't be so hard to expand with additional ones. And obviously, additional funding is needed as well. But that's going to be a big deal because we have been short staffed and unable to provide the kind of services to jails, for example, that they need to have. And we want that next level of service as a community behavioral health. The 988 suicide number is a big deal because people don't remember a 10-digit number, but they might remember three. And so funding was put in place. The original bill was 30 cents on our cell phone bill. And the broadband people fought that because they didn't want another fee, another tax. It's not a tax, it's a fee. And anybody who's got $1,000 phone can probably afford 30 cents a month and not notice it. But they were strong enough to be able to get it changed to a state appropriation. So almost $1.9 million is put into the budget. So I'm sure glad we had it, had the money to do this, because the resistance from the broadband people to having another 30 cents a month on the bill was overwhelming. And I'm very disappointed in that. I don't think anybody would even notice it. Federally qualified healthcare centers for the first time got additional funding, $2 million, and there will be a study to see, and I'm confident that this is going to turn out in a positive way, how the expansion of current uh, federally qualified healthcare centers that are in the small communities, because most of them are, would benefit healthcare delivery, especially in rural North Dakota. And I would invite any of you who are going to be, well, particularly in Fargo, because I'm familiar with that one and it's the biggest one, but to encourage you to visit one of the federally qualified healthcare centers that you have. Bismarck is served by Underwood or Turtle Lake, whichever it is up there, with kind of a little satellite, but they should have a full-fledged one as well. And they have 10 dental chairs, for example, in the Fargo one. And because it's federal, they serve people on both sides of the river, which for us who live on the border is important. And people drive for some distance to get dental care in the chairs there. The Health Council, oh, back up one. Funding for the rec centers for individuals with developmentally disabled clients or visitors. The funding was supported better than it was before. I want to see that eventually move forward so there are more of them. There are only two right now, but we want to see that because they're very popular with the folks who are living in Fargo and Grand Forks, who like to visit and enjoy activities at those two centers. So that's something that we would like to see expand again too. The Health Council has long been in statute as an advisory group for the state health officer, the governor, and the legislature. But it gradually kind of lost its clout because they used to, and Senator Howard Anderson was a wonderful member of that for many years, and now Senator Kristen Noors is at this time. And it's a lot of providers and then a couple legislators who are on there for the state health officer or the department, the division now of health, to bounce things off when they're talking about issues to face. And a logical time for that would have been during COVID. But the Health Council was never consulted. It was not the health officer's fault. We had a couple of them during that time. But anyway, now we changed it so it's no longer at a point. They're not no longer appointed by the governor, because then they're going to be beholden to somebody. Instead, we designed it to be similar to the advisory council for the medical school. And the sources then of the seats that people occupy there are organizations representing providers, hospitals, physicians, nurses, long-term care, all of that. And they are an independent group, which were very instrumental in the work that was done to build the new medical school building. And with this new group, they're also designated the same way. They will be representing these various groups, and they will come together and they will be able to be uh, kind of support for the state health officer, and also as they're developing rules in the health department, in the health division, I should say, they can visit with the health council, because sometimes the professionals can say, well, this is the way it ought to be, and then a legislator will come along and say, well, that isn't going to play in Peoria, so we've got to do a little different thing there. So it'll be an opportunity to make sure that they will be able to get through administrative rules processes smoothly. There will be liaisons to those legislative bodies and have some input on that, but they will be able to work together to make sure that they're meeting the professional needs, but also going to be possible to support legislatively. There, 2265 is a bill on a dual special needs plan. That's for those dually eligible people who qualify for both Medicare and Medicaid. And by having one plan that is integrated for those individuals who qualify for both, it's not only going to be more streamlined in providing services to the individuals who are being served, but it's also going to be less expensive, because there will be eliminating some duplication. So that's being set up. 2276 is Medicaid coverage family caregivers. This is a first step deal, and it's really important, I think. But when you have a room full of mostly moms, but some dads, and little ones who are medically fragile in strollers or buggies or in their arms, where the parents have not slept all night since that child came home from the hospital, you know that there's a need for some respite for these individuals. And so this will allow, and the problem is that when they've been looking for childcare, we all know there's a crisis in childcare as far as workforce. The ones that they've been able to find, even if they trained them to do the medical procedures that were needed, that were not complicated, they weren't always doing them at all or doing them right. So it just wasn't working. And so usually the mom, but not only, was staying home. And as a result, it was a financial burden for the family. Excuse me. So this is going to be the first step in the program. It will allow payments to family members, so that it'll take a bit of the financial pressure off these families, whether it's an elderly person with dementia or a medically fragile child, because these individuals otherwise, in many cases, would be in an institutional setting. So it's obviously better if they can be at home, and the families want them to be too, but they also have financial concerns. 2335, fetal alcohol screening is established, and we've been visiting with Carl Young for a long time about that. And it's now included in what is the new Cross Disability Council. It used to be an Autism Spectrum Council, but that is being morphed into what now is a Cross Disability Council, which will consider all of these different entities who have similar but not identical needs, and we want to be sure that we're able to coordinate them well. Excuse me. 1048 is a House bill that had programs about developmental disabilities as well. 1418 is a Traumatic Brain Injury Advisory Council that restructures that a bit, and that's a real active group with Rebecca up at the University of North Dakota that deals a lot with the TBI group. There's some really interesting research coming out of the money that we spent 2 years ago for hyperbaric chamber work, and it's turning out to be, in some cases, really quite effective for individuals with traumatic brain injuries. In fact, gentleman who was the pastor at my church in Fargo had a traumatic brain injury as a result of being a chaplain in Iraq several years ago. And he really was having some serious medical issues. And so he's under the veterans program getting hyperbaric chamber treatments here. And he was telling me, he and his wife were telling about it last Sunday. And he just can't get over what a change it's been for him. So as part of the research project, we provided some funding to the UND Medical School so that it would be done under proper research conditions, because somebody else was going to do it and it was just flaky. But this one is being done under the proper criteria for research. And it's really kind of exciting to see what's happening there. So that's already established, and has a couple of good local private funders who are very supportive of this as well, looking at things like football injuries, for example, or hockey injuries too. 1447 is the opioid settlement fund, and so it's intended to be flexible. A minimum of 20% needs to be spent on prevention. But as Pam Sagnis, who knows more about this than anybody in the state, recommended to us, and we certainly believe what she says because she has information to prove it, a dollar spent on prevention is worth about $67 spent on intervention or treatment. And the flip side of that is that almost all of the intervention or treatment is reimbursable by some source, Medicaid, insurance, whatever. But prevention isn't reimbursed by anybody. So the prevention number may sound small at 20%. Putting up billboards doesn't help this, and she knows why and what to do instead. There are other ways to deal with that, but there will be prevention, intervention, treatment, and recovery categories of this work. But we didn't want to, started out having some numbers there. We didn't want to have numbers. Senator Hogue was pretty emphatic about having more money on prevention, and we understand why that seems terribly important. We want to, instead of hauling the babies out of the river, we want to go up on the bridge where the troll is throwing them in and get the troll out instead. But we do have to spend some money on prevention, but there's more bang for the buck in that area, because that, and fentanyl, of course, is a huge part of that whole thing. And then 1536 is the Indian Child Welfare Act substitute. As you may be aware, the U.S. Supreme Court is considering a case now that it's challenging the Indian Child Welfare Act, which does not support initially allowing an American Indian child to be adopted by a non-Indian family. And the local tribes wanted to, as other states are doing right now, replace that language and put it in state statute in case the Supreme Court indicates that the federal statute about that is not is going to be overturned. And Representative Jamie Davis is a tribal member who's a new House member, delightful young lady, and her brother, Scott Davis, was the Indian Affairs Commissioner for several years, and just a great family. And anyhow, he was kind of the ringleader on this, and then there was another colleague who's also a tribal member, who's a new House member, was a co-sponsor in addition to some other reps and senators. But that did pass, so the language is pretty much a mirror image. Well, that would be reversed. We don't want to say that. Would be a duplicate of the federal statute, so that there would be continuity in placement of Native children when there is at least not even going to the point of termination of parental rights, but particularly at the beginning when they're looking at foster care too. We had a lot of discussion about foster care and adoption. There were a fair number of legislators who didn't understand how the process was, and so we helped to educate them a little bit by bringing in the people who do the work from the counties and zone and the departments, and so now everybody understands, or some people understand it a little better. So that anyway is kind of, I think, the highlights, so to speak, of that 153 or 125 bills that we had. If you have any questions about other subjects, let me know, and I'll sure see if I can't respond.
Thank you, Senator Lee. That was an amazing report, and obviously you've got a very good handle on all things happening in human services, so I appreciate that. Are there any questions by the commission that the report brought up?
I have a quick one. Senator Lee, you mentioned the guardianship bill, and you said it was broken into three, but do you have the numbers on those by chance?
Excuse me. The one for the judicial is 232345. Hang on, I'm backing up to Mr. Bernstein's message because I asked him for a message today. Just let me scroll a little bit here. 2222, 2224, and 2225.
Thank you.
And then 2139 also increased the amount provided for indigent burial to $3,500 for cremation and burial. And 2012, which is the Human Services budget, provided for the DD guardianship, and that amount came in at $800,000. And 2015 is the funding for adult indigent guardianship. That would be the Office of Management and Budget. That's the last bill that ever comes through the legislature. So those last three that I mentioned, 2, 3, 4, 5, 2012, and 2015, are the three parts that of the bill that got, when it got broken up, those are the parts. It's 2012 is a long read. I mean, that's, I don't know, 67 pages or something in the Human Services budget. And OMB isn't a whole lot shorter, but that's where they are.
Thank you.
Any other questions? Anybody online that wants to?
Oh, that was for the chat. Oh, that's just Caitlin. Be right back.
Okay, and you mentioned that Representative Mitzcog may try to join us or might not be able to.
Well, I suggested, I don't think she'll mind if I tell you that she hasn't seen her family really for 4 months, and they just took the kids and grandchildren to Orlando, and when I called her, they were just checking into the hotel. So I said, oh, please, your priorities are in the right place. She was going to try to call in from there, and I said, for heaven's sake, go sit in your hotel room and talk to us, because I think I can handle it. And if there are any questions we need from you, we'll get them next time we chat. So I hope she's enjoying a little Florida time in Disney World.
It makes sense, and you can tell her we thought you did a great job. So
She did. She did a good job.
You did. She did a good job, but you did a great job of presenting. So thank you. And I'm thank you for that update. The fourth item on the agenda is public transportation education, and I'm going to turn that over to you, Jana, to lead off for us.
Sure. Deidre is here from Bisman Transit, and I think she was going to have a little presentation for us. Yeah, you want to just take it away?
Yeah. So thank you everyone for inviting me today. So I'm the executive director for Bisman Transit. We provide the public transportation here in Bismarck, Mandan. We do offer paratransit service for the city of Lincoln. So I just wanted to cover a little bit of the history of public transportation in our communities, some of the issues that we're running into, and then some of the things that we've been working on in the past few years. So the Bismarck Transit Board was incorporated as a nonprofit organization in April of 1987. The organization's aim at that time was to coordinate and establish transportation services for elderly and disabled individuals in our community. However, it wasn't until May of 1990 that enough funding was secured to begin the service. Over the years, our communities grew and the need for the fixed route service became apparent. The fixed route service is for the general public, so until 2004, when we provided our first capital area transit ride, we did not have any general public service. Currently, Bisman Transit is contracted by the city of Bismarck to provide our public transportation for both elderly, disabled, as well as our general public. We actually provide 3 different services: the fixed route service, or CAT, so the big buses that you see around town, which runs Monday through Friday, 6:30 a.m. to 7 p.m. Saturdays, we start an hour later at 7:30 a.m. and end at 7 p.m. and we do not have any general public service on Sundays. We have 6 routes in operation, 5 in Bismarck and 1 in Mandan. All routes operate a 1-hour loop, except the purple route in Mandan, which is about an 1.5-hour loop. The second service that we offer is our door-to-door paratransit service. This requires an application for elderly and disabled individuals over 70 to qualify for. Paratransit service is federally required to operate at the exact same hours that our fixed route service operates. The last service that we offer is our after hours service. That's kind of what we've tagged it. And it's anything that is in operation outside of the fixed route hours of service. So we actually start our paratransit service at 5:30 a.m. and we end it at 12 p.m., well, 12 a.m. technically, Monday through Saturday. And then on Sundays, we operate from 7:30 a.m. to 2:30 p.m. So anything outside of those hours that the fixed route isn't running, we're not federally required to do it. It is a service that we're doing above and beyond the requirement. each one-way fare on our fixed route service is $1.50, and on paratransit it's $3. I think it's important to note that because that is not the cost that we incur for the operation. Like nearly every public transit organization, funding is one of the most significant pain points that we experience. This isn't a new issue for us. Lack of funding actually led us to make some pretty significant cuts in service back in 2017, where at that time we were running a 24-hour service. The service is funded by 3 Bismarck mills, 2 Mandan mills, and a couple of federal grants, as well as some state DOT funding. A small portion of local revenue also comes from fares and advertising. I do want to note that it is a small portion, again, of that local funding from fares. Each one of our paratransit trips costs us about $25 to $31 an hour, so we take a pretty big hit on every single trip that we complete. Considering all this, Bismarck Transit is looking at significant shortfalls in the upcoming years. The Bismarck Mandan Metropolitan Organization and Bisman Transit are in the middle of our transit development plan study. A third-party organization out of Nebraska is actually doing that, and we're about halfway done. The biggest thing that they're looking at is how can we make ourselves more sustainable. We're constantly chasing this ball that keeps rolling down the road of we're running out of money, we're running out of money, we're running out of money. And that's not uncommon in the public transit sector, but with the service that we've provided for years and years and years, that exceeds by a pretty significant amount what we can continue to offer. So if more funding isn't secured, the conversations about service reductions will need to occur. Right now we're providing about 15,000 trips per month. That's with our fixed route and our paratransit. April was actually the first month our fixed route ridership exceeded our paratransit since before COVID. So we're seeing quite a significant rise in ridership, but we're not quite back to pre-COVID numbers. Ridership wasn't the only thing to take a hit because of COVID. Supply chain issues have made it nearly impossible for us to replace our paratransit vehicles. A bus that would have cost us $80,000 in 2019 now costs us about $160,000. So almost doubled. Well, it did double. And it takes about 2 years for us to get those buses. So with our current fleet replacement schedule, we have buses that are stacking up that need to be decommissioned and sold that we don't have replacements for. Lastly, National Express, which is my subcontractor, is not immune to labor shortages, especially for our operator positions. With the lack of drivers and bus replacement issues, we have run into some capacity problems during our peak hours of service. So that's our 7 a.m. to 9 a.m. and then 3 p.m. to 5 p.m., where we can't complete all of the rides that are being requested within a 1-hour requested window. I say that because that's what's federally required, is that we are supposed to be able to provide each one of those trips within 60 minutes of the time that someone is requesting. Right now, we don't have enough vehicles or drivers to do that during peak times. I'd say we're getting about 3 to 5 a day that we can't complete. To help kind of negate that issue, we have suspended subscription services until further notice. Not to say that we won't resume subscription services at that point, but we were also running into capacity issues from a lot of the day programs and agencies where we were exceeding 50% of what we could do with subscription services, which is the ADA violation. So although it's inconvenient for us to not have subscription services and inconvenient for the riders to have to call in and schedule their rides day in and day out, it was something that we needed to correct so that we were compliant with ADA. But we've also ordered a couple of vans with a shorter delivery time to help with some of those capacity issues. Unfortunately, now we're spending funds on smaller vehicles that have less room to transport, but we kind of are between a rock and a hard place here, where if we can't get the buses, we got to do something. The last item I wanted to discuss before I open it up for questions is some of our ongoing public outreach efforts. We only have technically a staff of 3, so myself, I have an accountant, and I also have a marketing and mobility specialist. So we have our hands full with what we're doing administratively, but we also do our best to try and come out to public outreach events. We'll actually be at the Touch a Truck event in Mandan on the 20th. So we bring a big bus out, let kids run through it. We also try and participate in every orientation day for colleges, anything that agencies are requesting, and we offer free travel training. So I think it's important to note that because we have a lot of individuals who want the flexibility of the fixed route service where they don't have to call and schedule their day or their ride a day in advance like they do on paratransit, but they're apprehensive about using the fixed route system. So what we'll do is we'll do a train the trainer if they have a social worker, a caseworker who is working with them and try and get them on the bus and get more comfortable, or we'll work directly with the rider to ease them into the situation that they might have a little bit of anxiety about. With that, I'll open it up for any questions that you may have.
Anyone, Commission?
Do you want to talk about what you know, Deidre, about some of the concerns in other communities, both with rural transportation and our friends in Minot, which I take it Bisman has kind of an informal relationship with, just to give people a bigger idea about this, because this is really a large problem and concern, right?
Yeah. So Minot, I know they're now to the point where they're going to be viewed as the similar type of organization as us, a small urban. So they're going to start getting some federal funding, but they actually have more invested per capita in public transit than we do. So they're doing a little bit better, but they have similar issues post-COVID where ridership was down significantly, and we're trying to overcome all of that as a statewide, effort.
What level of federal financing do you have, or funding do you have?
So we receive a 5307 operating grant, and that's our standard grant. It's about $1.7 million. Majority of that is at a 50-50 split. So our mills cover the local match, and then our fare revenue covers the local match. A portion of it is an 80-20 split, but that's our standard formulary grant. We get that based on our ridership, what we're reporting, our number of revenue hours, our revenue miles, and then obviously the census data. That's what comes into play with that. Then we have a couple of competitive federal grants that we have to apply for every year. A 5310 grant, which actually helps offset the cost of our after-hours service. We get that covered at a 50-50, but the thing about the competitive grants is they're great when they're there, but I always fear that they're going to run out and now I'm going to be stuck paying 100% for something. So the only their grant that we know is there is the 5307 at 1.7.
So what is the annual budget that you have? I mean, in terms of, you just mentioned 1.7 and with some matches, things like that. Does that cascade into 3 million or 5 million? Or?
Yes, yeah. So our total annual budget is about 6 million. So we have a little over 2 million in mills, and then with everything all said and done, we're at about 5 to 6 million each year just to operate the way that we are.
And what do you really need?
We really need about 1.3 million extra every year. Right now we're running on our cash reserves. So though COVID was really a terrible situation, it helped bail out a lot of transit organizations with CARES funding. So Bismarck received $3.7 million in CARES funding that required no local match. That let us kind of right the ship for a while and bought us some time. So we were able to bank up a good amount of money in our cash reserves to kick the can further down the road. But in order for us to continue operating that the way that we are and have about 6 months of expenditures paid for, so we're not failing to pay our bills, we need about $1.3 million more each year. And through the Transit Development Plan, SRF Consulting is looking at a number of options. One of those options would be a 0.1% sales tax for the city of Bismarck. That's the one I'm most in favor of because I don't think that we're going to have success going back and asking for additional mills. We're not maxed out on our mills because we only have 3 through Bismarck and 2 through Mandan. We can max those out at 5. I don't think there's going to be a lot of support from anyone with that. So to kind of help spread the pain a little bit, I'm hoping that we're going to be able to get that 0.1% sales tax that would be dedicated to public transit.
That would have to go to the public voting. Mm-hmm. So are you preparing to put that into effect or put it into
So we're waiting until the transit development plan is kind of more set in stone because there's going to be public hearings on the plan itself where that's going to be one of the key points, and then we'll start that process. So right now we have our budget basically will get us through 2025, 2026. So the conversation needs to start happening very quickly here to make sure we're not running up right against the wall. But I'd say this year sometime, those conversations will be starting pretty hot and heavy.
Here's some questions. So I appreciate you said at the end, you were talking about kind of the train the trainer and the working in order to encourage fixed rate route usage, especially, you know, in my world with people with disabilities. Do you have any idea, like, how frequently people who use wheelchairs or other mobility devices ride the fixed route? Is it common, uncommon? Any thoughts on that?
Yeah, we actually track the data. I don't have the statistics offhand, but I can definitely get you them after the meeting. Pretty frequently. Each one of our fixed route buses is equipped to have 2 tie downs for wheelchairs. Those are the only ones we track. If there's any other mobility aids, we don't track that, just wheelchairs. And even if we're using one of the smaller buses, which sometimes happens because we can't get CDL drivers, those are equipped for even more wheelchairs.
And I say this, I live in Minot, and when I first moved there in 2010, I asked that question, and they said, we don't know of when they've ever been used. That has since changed, but it was a heavy promotion on fixed route because they're cheaper, they're more consistent, and when people are using that, it relieves pressure on the door to, or curb to curb service. Do you also, so you talked about, you know, developing a transit plan for the city. Do you work in collaboration at all with your local city planners as well, as they make the layout of the community to ensure that, you know, especially as affordable and accessible housing is going up, that it is actually on fixed route systems in order to help, or, you know, help facilitate the usage of fixed route services?
Yes, so that is something we definitely consider any time we do a route redesign. Our last route redesign was February of 2021. So we actually shifted a lot of the routes into more of the lower income public housing areas. And then we do work with both Mandan and Bismarck when they're redoing roads, like Washington. South Washington is going to be redone, I think, in the next couple of years. And we're possibly looking at doing a bump out so that it's a safer boarding area. Down on South Washington is really narrow right now, and like Tatley Meadows down there is a high traffic area for our ridership. So anytime that they're redoing roads like 43rd, we're trying to be involved in that and push the narrative that public transportation needs to be considered when we're doing this, so that there's safe crosswalks and that there's safe loading and unloading areas.
Sure. Well, and I obviously we have a pretty good fan of what I'm about to say in the governor's office, but also as we grow within the city and now grow into green space on the edge of town, it also helps keep accessible, affordable transportation, or keeps transportation more affordable as well. That, you know, again, being from Minot, we just added a new bus route, 2 new bus routes, I think, if we can get drivers, because Trinity Hospital made the decision to move into the green space on the edge of town. And so as our city spends over $50 million to bring infrastructure to that, part of that is bringing the bus service to that as well. So if we can prevent that within the city planning processes, it can save a lot of dollars, so.
Yes, and in a perfect world, I want a shuttle that does more of the downtown where it's more congested, issues with parking. I would love to be able to have some sort of shuttle. Right now, we're not in a financial situation where I can push that too much, but it is a long-term goal where we are providing a faster service that can be established for the downtown area.
Sure.
Yeah.
And then finally, have you worked at all with, collaborated with, and you mentioned this a little bit, but how has the collaboration been with service providers within the community to really promote, I mean, and I sound like a broken record here, but to promote fixed route over paratransit services? Has that been successful, unsuccessful?
Yeah, we've gone out and done like Dakota Center for Independent Living. We've worked with them and done a class training where we had the entire group of people come on the bus with us. We'll work with like Heartview, Dakota Center for Independent Living. We work a lot with them. We have a board member who's the executive director there. So quite a few different agencies that we try and get in the door, but everyone's so short-staffed, it's hard to plan something with it. Anytime we're doing any public outreach for route changes or anything like that, we have a distribution list where we're trying to push their involvement as much as possible so we can get feedback before changes are made, and then 6 months down the road, we didn't like those changes, you know, how that goes, so. Yeah.
And I think that, you know, the hard part is too, is that North Dakotans in general, we're still an automobile-driven people. And so we all want to hop in our cars, you know, take 6 steps out of our door, hop in our car and drive 6 steps away from the place we're going. And that's wonderful when that works, but especially when you're dealing with people that are, you know, maybe don't have a whole lot of money, or people that have some sort of disability, or the population I work with, a lot of people that have lost their driver's license. And so when you can work together with those people to better increase that usage of public transportation, it can help to increase independence and also make, you know, as regards to this community, you know, independent living within the community much more possible. So.
Yes, absolutely. And that's why I like to bring up public outreach too, because the more I talk about that, the more people start thinking, oh, this agency would really benefit. And if they can get in contact with us, we'll make it possible for us to come out and do a training, or have them come out to the facility and get on a bus and become more comfortable with it. So if anyone knows of any other agencies locally that would benefit from it, you know, send them my way and we'll make sure that something happens with it, because obviously the goal is to make public transportation accessible and get people where they need to go in our communities.
I think it would make really good sense to connect with schools.
Mm-hmm.
I feel like the kids who are transition age and getting ready to move into the adult world, like this could very much be a part of like some of their independent living skills building. So that would just be a way to indoctrinate people to use the fixed route, you know, as their first choice if they're not going to be a driver.
Yeah. So we work with a couple of the middle schools. They'll do a scavenger hunt, and they have to figure out how to use the use the fixed route service. We won't do any trip planning for them. They have to figure out where they're going to get throughout town and plan their own trip. So that's a way that I think the middle school age is a really good time to get in there, because they don't have their licenses yet, but they're getting that independence, and that really helps make a public transit user for the rest of their life.
I think Veronica may have been, forgive me if I'm wrong, gearing towards those who wouldn't be assumed to be fixed route riders initially, so not you necessarily your typically developing middle schoolers, but those who are engaging in additional services, and are often already associated with other providers in the community who have people going to and from. Is there any work with the middle school special education services, or the high school special education services, or life skills for that transitional independence riding?
No, we did attend a fair one time at BSC at the, I can't remember what the learning center is up there, but we haven't had any communications with them about doing any other training. I don't have a contact for them. If someone does, I take it.
Senator Lee has her hand up.
Hi there. Just a couple of thoughts occurred to me. One is, it seems to me that Damian Schlinger, who's the director of vocational rehab, ought to be a part of this group, because he and I have talked a lot about transportation. Because I have a friend who lives in Bismarck who operates out of a motorized wheelchair and is often at the Capitol and working there during the session. And she was really struggling with transportation, because she was supposed to be at work at 8. This is before the session started. Supposed to be at work at 8, and she had to leave home at 6 in order to get there on the bus, and that's 2 hours, and she lives a mile away. She said, I just can't do that. And I understand, I wouldn't want to be able to have to do that either. So when we did a little homework on this thing, and she was talking to vocational rehab, and I was too. Turns out, and you could check to see if this is correct, but my understanding is from her research that Bismarck has an ordinance that says that all licensed cab companies have to have a certain number of providers of services for individuals with disabilities, like wheelchair accessibility or whatever. However, they don't have an ordinance that says every cab company has to be licensed. So none of the cab companies in Bismarck are licensed with the city, because then they don't have to meet that requirement. So, and when some friends of mine who live in Bismarck, because I have no standing in Bismarck, have tried to inquire into this, they have not gotten much of a hospitable response from the people who are elected or appointed to the positions that deal with this public transportation issue. I mean, I'm not beating up on the speaker, please understand. That's not the person they're talking about. But the problem is that the city has to recognize that there's a need for this. And I'm not saying I got everything going on right where I live, but there are 4 private providers here, because I followed one to an apartment building in order to get the phone number off the side of the van, that people can call in order to get a ride. Some of them are large enough that they can even haul a gurney. But the majority of them are going to be like a van, not a CDL requirement vehicle, but smaller vehicles that can accommodate a wheelchair. And I make a call because I know the concern for so many of the ones that have talked to me is that it does take an hour to get around to wherever it is they're going, and then it takes an hour before there's a ride that comes back to pick them up again. And that is, and I understand the driver shortage. I'm not absolutely blaming anybody for what's going on here, but that I'm just indicating that it's a really serious issue. And because of the resource issues, there are folks who like to work, who find it difficult because they can't get to and from. I gave a name to someone in Bismarck of these 3 of the 4 entities in Fargo, West Fargo, Moorhead that are private, that pick up, that you just, you pick them up like you would a cab, and they'll come and pick you up. And I don't know if they ever contacted them or not, but I couldn't imagine that they wouldn't be interested in expanding into the capital city of the state, because it's a big enough metropolitan area to make use of. Maybe not quite as many vehicles as are going on in our metro, but we've got 4 outfits that are doing it here too. So one of them is a little more specialized in hauling veterans to health appointments at the VA. And so that's a little more focused. But the rest are all general use. And the owner of one of them is an international owner of these all over the world. So it's not that big a deal to go from Fargo to Bismarck. I'm hoping we might be able to make some connection with those private providers too. But the city's going to have to provide some support for it also, and also some expectations of what needs to be available, and then the funding to meet those expectations. That's my soapbox for the moment.
Peter, I might ask, following that up, what is the relationship that you have with the taxi services, or is there still a taxi service?
As I know, there is one taxi service. I don't know if they're registered with the city, Bismarck Transportation Services. We have no relation to any of the taxi companies. They're a private company. We're public, obviously, so there's no relationship with them. I understand in the past, so prior to 2017, we did offer a partnership with Taxi 9000, where we would do like return ride homes, where we'd give people a voucher if they were looking for transportation outside of our fixed route hours. But with the federal requirements, there was a drug and alcohol policy needed to be put in place by that taxi provider for us to continue to fund them outside of the pilot period. They were not willing to implement a drug and alcohol policy, so we had to terminate our relationship with them at that time. So we haven't had any relationship with any private taxi companies since 2017.
I have a question, and if you know, like your fixed rate versus your paratransit, what's your breakdown? 4 million goes here, 2 million goes there. Maybe you don't know.
Yep, so it's a little bit heavier on our paratransit side because it costs more to operate it. Our fixed route side, it's a fixed rate, so I can estimate exactly how much I'm going to put at that every year. I know the hours of service that I'm going to be running that bus. So it doesn't matter if there's 1 person on the bus or 50 people on that bus, it's going to be the same rate. That's not the case, obviously, with paratransit. For every person that's on that vehicle, we're charged, incrementally based on revenue hours. So when we do the breakdown for the National Transit Database, it ends up that about 52% to 54% of our funding is dedicated to the paratransit service, and the rest goes to fixed route, which is very uncommon. There is not many organizations in the nation who have a breakdown like that. Typically, fixed route costs more to operate in areas because fixed route is the dominant service. When I provided the history, a lot of that was to indicate that fixed route service didn't come until way after the paratransit service did for our community. So that really set the expectations in our community for the door-to-door service, which made it very hard for us to come in with a fixed route service and transition some of those individuals who might be able to use the fixed route for a portion of their trips from the one service to the technically cheaper service for us to operate. So that history is important to note, that it kind of put us in this situation where we are unlike nearly every other organization in the nation because we have such a robust paratransit service. Kirsten, did you have something?
I think part of the issue too within Bismarck is the lack of even fixed routes. I mean, I know in our neighborhood, it takes, if my son was going to take the fixed route, it'd take him about 20 minutes to get to the fixed route. And I'm not, and I get it. It's, you know, budget and all that. It's just something to think about that not everybody with a disability lives in affordable housing. And so there's parts of Bismarck that the bus doesn't even come or it's way out of the way, where it's unsafe for somebody to get that bus fixed route to. So it's just a thing. Just so you know, the Arc North Dakota, of course, did a study passed for CR 4004 to look at paratransit and transit in general in the state of North Dakota. Legislative management does have to decide to pick it up, but it's just something there just because these conversations keep happening. And it's sort of like I kept saying to Senator Clary was our sponsor, and I said, you know, everybody kind of has these options and this is what we think would be best, and no, these things would be best. I think it's just figuring out what the state's doing and where that funding, you know, does Department of Transportation, if there is funding available, how to get that funding to those transit and those communities that really need it. So just so you know, keep an eye on that. So.
Early questions?
Just had one on the tail. Do you still provide the free medical transportation to appointments? Paratransit?
So if the individual has Medicaid, we can use Medicaid to pay for the trips to and from doctor's appointments.
Do you do anything with Medicaid with the non-medical transportation?
Nope. Nope, it gets denied every time.
Well, yeah.
Yeah.
Can you talk about any collaborative type work or arrangements you have with other transit providers across the state? I mean, I'm in Bismarck. I hear a lot about Bismarck, but like, we know this is an issue. So I'm just like wondering, like, is there an association you guys are a part of, or do you guys have relationships to kind of troubleshoot some of these issues that apparently everyone's having?
Yep, so we're part of the Dakota Transit Administration, which is a group of, obviously, North Dakota and South Dakota transit providers. So they meet every September. But that's also the network of individuals that we can reach out to. At our location, we're also a hub for Jefferson Lines, and we're also a stopping point for Suez Basin. So if people are trying to get to Minot, they can come to our facility and get transportation as long as it's scheduled through that organization. But there's no direct partnerships, just more of a friendly association.
Gotcha. We do have Sean Crowell on virtually as well for the Fargo area, so he'll do his next when Deidre finishes up.
I've got another. Do you know, the way you talk, what are you doing to say we need more money? We need to expand this. I mean, everything you've said has been, well, we can't afford this, and this is costing us this, and I can't do that. And I don't talk that much until I know what I'm talking about. And my daughter's tried to use both the fixed rate, the para. It now uses Roxanne and Bruce transportation, okay, every day. So she works, she lives in her own apartment, but mom and dad transport her every day. And, I'm not gonna go into why, but it just didn't work, period. So why isn't somebody saying, we got 6 routes? Well, there should be 8 or 9 routes. You might have to scale back, para. And I'm not picking and choosing, just somebody has to make hard decisions, obviously. And again, just like Senator Lee said, I think we calculated Liz would take an hour and a half to get a mile and a half to her job, so it's like, when it's summer, she can walk that in 20 minutes, so it makes no sense. But when it's winter, she needs to be driven or get a ride. So, those are things, I'm concerned about, but, I'm wondering, because that's what I think our mission is to say, this doesn't work. How come we're not doing something more to make this happen, for people that can't, so that's my question. Is there somebody saying, hey, we should look at this, or we're just trying to make it to 2025?
So we have our priorities, and obviously the understanding that 2025 is kind of the cutoff if we don't receive more funding. The priorities are A, get the funding, and then look at obviously expansion. We know 6 routes isn't enough. Our service area is 54 square miles, and we're trying to cover that with 6 routes in 12 hours. It's not possible, and it's not a system that's going to be usable for a lot of people. With the transit development plan that has been presented, some of the financial challenges, and we're starting those conversations, that was presented to the policy board and the technical advisory committee last month. So the plan is not finished.
And also to the city commission.
And to the city commission. So the plan is not finished. Once we have worked with the city administrator and my board has come to an idea of what we're actually going to do to take action, within the next few months, we're going to start having the conversations where we go to the city commission and say, we need this, what can we do to get this? So we know there's a problem and let's just keep operating. We know there's a problem, now what do we need to do to fix the problem? Each route is about $250,000, $275,000 for us to operate.
Okay. Is the county involved?
No.
Why?
We do not operate outside of the city of Bismarck except to.
The funny part is the city of
Mary.
Bismarck is in Burley County.
Yep.
So that's kind of a funny dichotomy, but
Well,
that's
you
anyway.
could with a 3/4 mile.
Yep. So when we pulled in our service area in 2017, there was no desire for any funding from them any longer because we're no longer operating what they feel outside of city limits. The only area where we operate outside of city limits is to get to the University of Mary and back.
And Lincoln.
And Lincoln, which we do the paratransit. We operate within the city of Lincoln, the limits.
How many drivers do you have? It sounds like you're short of drivers.
31, we need 37. We have a couple in training right now, but obviously CDL drivers, that takes a while to get them trained up and then to get them trained up on the routes. So that's usually about a month and a half turnaround time before we hire, from hire to on the road. So we have 3 individuals, 1 just passed his CDL and should be starting on the fixed route side, and 2 that are in the process of taking their CDL license. And then we had 2 paras start yesterday that both quit immediately.
Oh.
So it's a struggle. I know every industry has it, so I'm preaching to the choir about it, but we're doing our best. There's a very rigorous background, so it's not that we're all fighting for this pool of applicants. Someone can go and work at, say, Walmart and not have to go through a background where they can't have a DUI in 10 years, they can't have any moving violations, they can't have all of this. So the pool of individuals who can operate these buses is very, very small, and we obviously want to make sure that people that we're trusting to provide the service are doing the best to keep our riders safe.
And one question that came from you, what you indicated to us was you have to get new buses from time to time. Maybe there's a requirement that you retire them.
Yep.
What is that?
Yep, 7 years, 150,000 miles on our smaller buses. So we are operating buses that are older than that and are outside of the useful life in miles. So our 2017 buses are over 200,000, and we do a really good job of maintaining them. It's not that they're going to fall apart. It's that the FTA, or the Federal Transit Administration, wants us to adhere to their useful life standard, because then we start investing too much of their capital money to repair these vehicles. So we have a time frame where we can use the older vehicles, but that time frame will run out before we'll probably get new buses. So.
Is there any source of funding for buses?
Yep, so we apply for 5339 federal funding. That covers any ADA accessible buses at an 85-15 split. So we have the funding, can't get the buses. We can get the fixed route buses in 6 months to a year, which typically used to be 2 years, and now it's completely reversed where we can't get the paratransit buses. We operate Ford chassis, and with the Ford issues, with the chip issues, they canceled our orders. So I had submitted orders spring of 2021 for buses and they canceled them all. So yeah.
That's a silly question. Are you allowed to keep the buses that are out of commission for rides and use them for the training exercises and your displays like Touch the Truck, or do you take a bus off of a route that's in service to do those things?
No, so we have a spare ratio where we're able to keep buses for like Touch a Truck. We have right now 3 spare fixed route buses, so we would never pull a bus from service to do a public outreach event. And we can technically retain those vehicles. We don't necessarily want to keep them on our insurance, so we like to sell them when they still have a little bit of value, and then we use whatever funds that we do receive for the sale of the vehicle, that goes towards investment into another capital asset, like another bus.
Have you tapped into the CDL driver training programs to try and recruit drivers?
Yes, yes. They, National Express is my subcontractor, so they actually deal with all the hiring and training, and they've done pretty much everything that they can. They have, right now, I think it's $2,000 sign-on bonuses. The general manager for our location, Craig Thomas, he actually does the CDL training himself, because then he knows exactly what those drivers are going to be doing when they're on the road. He feels more comfortable knowing that.
Can I ask what your CDL rate is?
So right now it's $20 an hour starting. We just negotiated, and hopefully it'll go up to about 22 this fall.
Is it benefited?
Yes.
Because it's comparable to what is offered in a lot of parts of, or not comparable necessarily depending on the area.
Yeah.
Geographically and career-wise, and so just wondering.
Yeah, so we looked at the service standards in the area for what people were getting paid for CDL and non-CDL, and we're pretty close, and then hopefully we'll be on the high end coming here this fall. Senator Lee had her hand up again.
Well, I was thinking about the fact that all we're talking about is public funding. And it doesn't all have to be public funding, which is why I talked about these 4 private vendors. Even if there's state or city support of some sort for these local providers, it's just, you don't have to have big buses then. I mean, these are all small, like plumbers vans kinds of things, you know, that's what they're hauling people in. It's not even a paratransit minibus. So they're much more nimble, and it's the fact that you don't have to have a bus full. And so I'm just interested in why the city wouldn't be pursuing that. I can get that information to people again if they care, but I don't mean that the public entity shouldn't be involved, but I don't think it's all the city's responsibility to buy vehicles and get drivers and make this available. I think the private sector has a role in this as well, and they can supplement and actually complement one another. They're going to be able to go to areas where the fixed roads can't. And together they might be able to make this work a little better, depending on what the disability is of riders. So I would encourage you to look at it, Bismarck, exploring this idea of the private providers, either establishing new ones there or expanding from the other places that they are, in order to develop programs in your communities as well.
Senator, do you know if Fargo is supplementing these private drivers?
I don't think so, but I can find out.
Just curious. I mean, it's unusual that the population we're thinking of can't pay cab fare, you know, so if that's
No,
what
I
that
get
is.
that. But some of these,
Yeah.
there are some situations in which there are vouchers given, or like Medicaid eligible
Yeah.
people, so that they can get to a clinic appointment or something like that. You know, that kind of stuff is going on. But the zones, you know, locally have to think about how they're going to do that, and the state has to enable it. But I can ask about that. That's not a problem. But I mean, I think looking at the state for anything other than some enabling funding is about as far as we're going to be able to go with that. I mean, we've been challenged for years with how do we deal with older adult transportation in the rural areas, because they maybe can't get to the pharmacist anymore, or the grocery store, or the doctor's office, or whatever. And we don't want everybody to have to leave home. But where is the point where it's not the government's responsibility to make that happen? You know. Now, with people with disabilities, I do believe there's a government responsibility to make that happen. So but I think they could be a partner. So if there's a part of this need that is addressed by the city, and I don't think it would kill the county to participate. I will point out though, when you mentioned Burley having Bismarck as a part of it, is that we all pay county road taxes, and yet the cities that are incorporated don't get a nickel of that to fix our streets. That all goes to farm to market roads in rural areas. I'm not complaining about it. I'm just telling you that's the way it is. So anyway, nobody said it was fair. It's just the way it is.
And
Conrad,
I
go ahead.
have a comment too, just from a writer perspective. Even when you're trying to do legislative session and having to schedule sometimes around legislative, it's really hard. I had to schedule 2 weeks in advance just to guarantee times, and if something changed, then I would use BTS, and they're $42 away.
And Trevor was a faithful attendee at every day of the legislative session. I don't think he missed a day.
Yeah.
Well, one thing, what you bring to mind, I've been involved in the past with the Bismarck-Mandan Chamber of Commerce. And whenever we've had to have a consideration of the sales tax, there's an awful lot of public debate in that body. You know, they're community leaders. And if you're going to have a sales tax, you need the community leaders behind you as well. But if you put some responsibility on them to say, for the good of our community, we need to get this service expanded. I mean, there's a natural alliance that you should be maybe looking at. Maybe you are. I don't mean to assume that you're not.
Yeah, to an extent. And that's part of why I wanted to come talk today, so that I could get a little bit more people in my corner when it comes time to have those conversations. So there is some allies, I would say, but not enough.
But that becomes your private sector, because all of the major organizations, businesses in town are typically chamber members. Mm-hmm. And it's a pretty good and active chamber. So I mean, that'd be the first place I would go for trying to get the public-private piece that Senator Lee's talking about.
Good idea.
And what I would recommend is when you're talking to them, don't even talk about like people, talk about workforce solutions. Yep. Because everybody's short on employees, and if people can't get to your business to work there, that's the problem. So become an ally with them around that issue.
Or even patronize your business.
Yeah, that as well.
Then I know that we have others to talk about the same issue, so but thank you very much.
Thank you.
Appreciate your willingness to provide us all the information you have.
I am going to sneak off. I have another meeting that I need to get to, but thank you guys so much.
Thank you for joining.
I appreciate it.
Take care, Deidre. Thanks for being here.
Sean, are you ready?
Hello, yes, I'm here.
Thank you. Take it away.
Well, I guess to be quite honest, wasn't entirely sure what to talk about today. But I find it interesting listening to the conversation going on so far, because we can mirror a lot of those struggles that Bismarck is going through. I can speak mostly regarding the paratransit service. That's what I work with mostly here in Fargo. I don't deal as much with fixed route or with actual funding. But so we have trouble with recruiting and retaining drivers. So we've had to reduce our service hours about an hour or so. Of course, so that impacts fixed route and paratransit. We do, even though we don't have fixed route service on Sundays, we do offer a paratransit service on Sundays. And we used to limit it to 2 buses, but because of driver shortages, we dropped that down to 1. So it's impacted our riders quite a bit there. But one thing that I've noticed regarding ridership is, regarding paratransit at least, is coming out of COVID, our ridership is up quite a bit over it was prior to COVID, which I thought was really interesting. About 2019, I'd say we're doing in the peak winter months probably about 250 rides per day. But coming winter of 2023, we've been doing close to like 270, almost up to 300 rides per day. So it'll be interesting to see if that levels out a bit, and if, because typically in the wintertime, our demand would increase and then we would drop down to about half for the summer months. So I'm curious to see if that will follow the pattern once we kind of get more out of COVID. But just a few thoughts. Does anyone have any questions for me regarding Fargo paratransit, or?
What is your hours of operation there?
Right now it's Monday through Friday. It starts at 6 a.m. and we go to 10 o'clock or 10 p.m. And then Saturdays we start at 7 and go to 10. And then Sundays for paratransit, it's 7 a.m. to 5.
And no holidays, correct?
Well, we're closed for some holidays, but for other holidays we're operating. Like we're closed for like Christmas and Thanksgiving and stuff, but we're running on like President's Day or MLK Day, holidays like that.
Do you have similar issues like Deidre has mentioned in terms of drivers and getting units of transportation? Same kinds of things?
Yep. What she said was true. We're keeping our vehicles longer than their, expected life. So, and same with the para vehicles, we, are keeping them longer than we want, but we just can't get new vehicles, again, because of that chip shortage. We did look at some alternatives to, so for instance, around the 3 to 4 o'clock hours tend to be one of our peak hours. So, because we have had such high demand and low resources as far as drivers and vehicles go, we've actually, brainstormed and put into service one of our transfer vans to go pick up people at one of the vocational training centers, just to kind of help take that pressure off the other drivers. Like we scheduled ambulatory passengers for that. So we're trying to think out of the box a little bit as far as trying to meet demand with what vehicles we have. And then we also, instead of getting a paratransit cutaway like we normally do, we got a Ford Transit van, which does have one wheelchair. So it's accessible. It's one wheelchair lift in the back, but it's primarily intended to be used for, we'd schedule ambulatory people to that. It's like a little bit easier to drive. And so we have been, like I said, brainstorming and trying to figure out ways to meet demand with the resources we have or can get. So.
How do you schedule?
Well, we use, for paratransit, we schedule using Route Match. And so we schedule 7 days out. So right now we're scheduling for Thursday out through next Wednesday. And we schedule 8 a.m. to 4:30 p.m. Monday through Friday.
Did you do anything different after COVID, like advertise or market that increased your ridership, or do you have any clue how that happened?
I don't know. So I started in transit in 2016, and it followed a pretty regular pattern of we'd peak around December, January, February, and then it would start to level off. And then, we'd be around 250, 260 rides per day at our peak. And then we drop off to like 160 to 180 rides in the summer. But in the last year or so, it's kind of, our ridership's just increased. Like, we didn't get that normal, I guess, attrition of riders that come and go. But I can't explain it. only thing I can say is that maybe COVID affected it. We, yeah, we, regarding costs, I know that was pretty similar too. So we charge $3 per para ride. And our fixed route is $1.50. And we calculate that it's about actually $38 to transport someone on paratransit. So I just wanted to mention that the cost is much greater than what we actually charge. So.
Now, what is your service area? Do you get over into Moorhead as well? Or?
Oh, yep. Our service area is we operate with Moorhead Transit. So our service area is Dilworth and Moorhead in Minnesota, and then also Fargo and West Fargo on the North Dakota side. We don't do the 3/4 mile. We just do the service area is the city limits.
Any difficulties between states in terms of what you can and can't do regulation wise?
No. It's the same across both. So Moorhead Transit funds a number of our paratransit cutaways, as just then Fargo, pays for the rest. And but for the fixed route side, I know that Moorhead has their own purchased vehicles that only operate in Moorhead, and then Fargo has the ones that only operate on the North Dakota side, I should say. And then we do also partner up with Senior Ride. Senior Ride is through the Park Service, and we have purchased vehicles for them, and so we do have some oversight responsibilities with them. But they transport people who are 60 and older, who are functionally able to get inside or to the vehicle on their own, like at most using a walker, because they have a fleet of minivans. They can't transport any wheelchairs, but that does take a lot of pressure off of our paratransit service. And we offer paratransit like ticket books for $60 for 20 rides, and they will take those tickets on the senior ride as well, because they only charge $3. So.
The same question we were asking with Deidre too is any relationships with the taxi services? I know that Senator Lee's mentioned some of those.
Yeah, no, not beyond the occasional, we might call a cab for somebody under extraordinary circumstances for some reason. But no, we don't have any agreements with them. And it's mostly because of, like was explained before regarding the drug and alcohol policy, that would, the cab companies would have to follow that. And to be fair, we haven't explored that more. It's just that we didn't think that they would actually go for like having a drug and alcohol policy in place in order to partner with us. But
I have one more question for them. How is your guys' funding? How is financially? How are you guys doing?
well, that's, I'm not really in the loop too much on the funding part. However, because of the most recent census that has placed us, we're starting to transition to a large urban, and so that process is starting. So I can't necessarily speak to how well our funding is, but that's going to be happening for us in the future. And then we will be getting funds for other agencies like Handy Wheels in town, or even Senior Ride, where we would be able to provide them with certain amount of funds that we get from the federal government. So.
Senator has her hand up.
What's that, Dana?
Senator Lee has her hand up.
Oh, I didn't mean to, sorry.
Oh,
I
okay.
forgot to take it down. There we go.
Okay.
Let's get rid of that. Sorry.
I was gonna say, Sean, there hasn't been a change in eligibility criteria that would sort of be a factor of the increase in ridership for para?
No, no.
There's-
I'm the one
We're not-
that, oh yeah, I'm the one that, reviews and, and processes all the paratransit applications. And I haven't changed my process as far as that goes, in the 7 years I've been here, so. No, I can't explain it. I'm just curious to see if it just kind of gets back to normal as we move out of COVID more, the next year or two. I've already started to see a little bit of leveling off this spring from our highs as far as ridership goes, but I guess we'll see what it looks like, next winter and next spring. So.
Well, any final questions? We've got still a good share of our agenda to get through, but appreciate your participation, Sean. Thank you for your attention and also your presentation.
Yeah, thanks for inviting me. I appreciate it.
Thank you.
All right, Jana, do you want to lead us into the fifth strategic planning side of it?
Do we want to take a quick break before we get into
Yeah,
that?
we're about halfway through our allotted time, so maybe let's take a 5-minute break at this point.
Sure. We'll be back at, who can do math, 2:43? Ish.
Yeah.
What are you doing?
Restart it.
Yeah, did you just drive down today?
43, yeah.
Yeah.
At least it's a nice day.
Very.
Better start being straight with me. I didn't kill him. 2 weeks ago, he tells me he wants to have a lecture on this. Completely out of nowhere. Says he's trying to change his life. Now I'm thinking he's being pushed. So I start offering better equipment, a bigger piece of the business. Whatever he wants to assist, he's really getting it out, and then I can't change his mind. It was like something changed in his life. So I was gonna let him out. I just needed to get the I didn't care. Well, until I can rule her out, it doesn't matter what I think. He has motive. She also doesn't have a motive. She could just rechecking. I asked her to stay in town and I don't let her. Everything. Selling his steaks in a restaurant, a backpack. Just before. Hey guys. Hey, I'm so sorry to cut off. Time to put the hat on the Vic. And? Well, the guy I know runs paper for a local bookmaking brand. That's been a fruity. That wolf doing business with the bookie at Tim Bridges Bar. That big. Cash. Does this bookie have a name? What's his name? Detective Beckett, NYPD. We're investigating the murder of Balthazar Wolf. Never heard of him. Really? Well, given the marks on his body after the beating your boys gave him, I think you have. What happened? He get in too deep with you, so you had to take him out. You really think I'm gonna tell my business to a cop? It's either that or you face murder charges. That can't be good for business. All right. Let's say hypothetically that I'm April 4th. And let's say the sake of argument that he owed a lot. How much? Hypothetically. Maybe. Okay, so maybe he needed some encouragement. Maybe the encouragement went too far. Maybe it was the right amount. Maybe Joe was married when? When? The day he died. Cash was $5 on the table. After his ring back. His ring. Good ring. Diamond engagement ring.
tries to collect that for money. Gave some sob story about a woman how he spent everything he had on a diamond ring. So when my guys go to give him some encouragement, oh, what a nice diamond ring. Nice. Set it back 10, 15 grand. My money. So you guys took it for what? As incentive. That worked. I got my money. He got his ring. And he goes home alive. Hypothetically. That's why he broke things up. That's why he took 50,000 out of his account 2 weeks ago. Well, then where is it? Restaurant, right? You didn't find it. Crazy. Yes, we did find it. Just didn't know it. You remember what Spike was saying about cake? God, shake. He was going for but dude, why isn't she coming? She's scared. Maybe she's in danger. Counting. I would never expected that my sunroom would have cost $1,600. Thankfully, I had insurance and it was covered. I saw the bill was. As a mechanic, I always recommend my customers have it on. You never know when a breakdown can strike. Need coverage you can count on. A broken AC unit costs over $1,800. Transmission over $3,000, and an engine over $4,000. Lifespan of my policy repairs, I've had 5 claims. That is $3,500 that I've kept in my pocket. Call now and we'll upgrade you to an Endurance Elite membership free with thousands of dollars of benefits at no extra cost. We offer a full down payment, low monthly plans, and a money back guarantee. So don't drive another second without protection. Call 800-581-6433 for a free price quote. That's 800-581-6433. Did you know you can lose weight with a plan that fits your budget and your goals? Introducing Quick 9, the Nutrisystem. Lose up to 9 pounds your first 2 weeks. You get delicious meals delivered right to your door with convenient shipments at an affordable and fast weight loss. I'm saving money and I'm losing weight. I saw results in my first 2 weeks. We know grocery prices are out of control. Now to lock in our special introductory offer, get over 50% off plus free extra. Get free protein shakes, a free shaker bottle, and free shipping. That's over $40 in extra savings and in New York. With Nutrisystem, I'm eating and I'm saving money. The phone lines are open and reps are standing by. With Quick 9, lose up to 9 pounds your first 2 weeks. That's all. It's affordable and important. Get off to a fast start with Quick 9. Call or go. Get over 50% off plus free extras. This is going to be great. Is it looking at my hairline? Is black psoriasis rethink your everyday choices? So Tesla is a pill, not a cream, that can help you black psoriasis and OT. Don't come to Tesla. Serious allergic reactions. Tesla may cause severe diarrhea, nausea, or vomit. Some people take even Tesla. Depression, suicidal thoughts, or upper respiratory tract infection and headache may. Doctors have been prescribing the test. Don't hesitate. Ask your doctor. There's no predicting what happens next on Meredith. That ain't no fun. After the first. After the second day. How do you go? What's an engagement ring? It's romantic. Oh, it's a choking hazard.
swear, they act as though there's some cosmic reward. Crazy proposals. What a woman really wants is their his eyes bringing us out. What proposal Gina was very romantic. And was shaking so much from the cold was difficult getting that right now. So we decided. No. And David, I am so sorry for you. So David said that he wouldn't have believed it unless I'd shown him the thing. He had no idea who was proposed to. And neither did anyone else in his life. Back to the phone logs from the restaurant and Wolf Cell. Every call. What about the cafe uptown? Except all checked out. They're out of the relationship was still unique. Maybe the ring wasn't it. Maybe it was only okay, look, yeah, because you like it. Couch, you got to big bag. Look at that. Yeah, but burger isn't the usual. He did like big one. All right, let's see if you resweep his apartment. Never spent any time there. Not evidence. Hey, Maddie. How do you say I was off the hook? Yeah, we're just gonna have a party until after the 10 minutes. Why are you? You? Not yet. I had no idea what was so serious with Ellen. You think my girlfriend was close to? Every time I saw her, I was so I believe you ever tried it. Guy with the job 20. Not necessarily. I think of any recall. Sorry. I'm not lying to you. And I'm going to come down a little harder than I need. Operators on the phone. Been asked about him a couple years ago, but Bangladesh. Yeah, good. They had to give me. That person told me to get people. They had every day to me. Yeah, you mean like that makes you have to every morning just run in the back. The one who dragged me to stand outside front of the brownstone for hours on just to catch a glimpse through the window. Through the window. Wolf was going to Cafe Rex to meet his girl. He was watching her at the cafe. That's why there were wolves. Trying to gather up the courage to further her. So that's the story of the Pharisee cafe. Maybe that's most big secret. That's not his. That's just supposed to. I am working service. That's nice. Saturday. Dinner for the book. Let's try to set one. Don't take interest in it. Interest in it. I'm interested. At Consumer Cellular, we offer amazing 5G coverage by incredible customer service. But that wouldn't mean much without super low prices. You are worth half, just the largest carriers. Guess what? AARP members can save even more. Let's
to consumer cellular now and get unlimited talk and text with flexible data plans. NextGuard is the flea and tick protection that's #1 with vets. Your vet trusts it for her patients and her own dog. Plus, its delicious beef flavor is #1 with dogs. Use with caution in dogs with a history of disorders. Ask your vet about NextGuard. Why should I trade?
Not
There's
telling
been that
time
comment
very well, so
several
we're
times.
past
I wonder what the thought
our
was.
5 minute. And we have a lot to cover. in the
Ryan,
next
not to
hour
budge
and
in on
10
this
minutes.
conversation, but since I'm overhearing it, I will. Is I think the reason the Olmstead Commission kind of developed this advisory council was to address like participation of people with lived experience. So if there comes a time, that might be something for the governor to consider when he's doing a new executive order, if that happens.
Right.
Not to tell you what we think, but we will.
So I'm hearing the governor needs to revisit the executive order.
I'm learning to say things differently. It might be advantageous to look at considering doing.
Wally, I put your book on my to-read list, so I'll let you know what I think.
Well, I mean, even if job service stayed with the common, and I don't know, is it a DHHS representation or is it still needing that health aspect?
Janet, if you want to
Reel her in?
take us into strategic planning and the,
Sure.
if you want to emphasize it.
Yeah, so I put this on the agenda because as a newbie and going through everything, just trying to get more of a concrete definition of what our goals are, what I know we put inquiry process and the actual role of the Olmstead Commission, and looking back at minutes from other meetings and watching some of those. I know there's been some discussion on what our role is as far as systems advocacy or individual advocacy and how we want that to look. So I thought being in this position as a new member, that would be an appropriate thing to take a look at and try to nail down as much as we can.
Where would you like to go with that?
Well, I know that there was a subcommittee that developed the work plan for 2023. And I don't know if that's something that we do again as a subcommittee. Because we're already in, well, depending what year, if we're going off fiscal year or calendar year, I don't know what quarter we're in yet for some of the objectives and getting some of these things completed.
I think as we start, taking what we've set out, where our objectives and seeing how we're doing, certainly coming new into the position, so.
Would it make sense logistically that way to review a work plan prior to completing the TAC Olmstead plan? Redo, or that's back burning? Creating goals to then recreate new goals?
Right, so I think, yeah, we need to have a finalized, this is just my thoughts, a finalized Olmstead plan in order to create the objectives of the Olmstead Commission. So I don't know how far things got after the TAC assessment. I do have the updated calendar, but that's about as far as.
Yeah, I think you got us right at that crossroads because I don't think much has happened.
Sure.
So, anyone else has a different opinion about that? That was kind of where the transition happened. Dan.
Mm-hmm. So really, I wanted this to be more of like a probably open discussion or try to figure out a game plan.
There weren't any subcommittee or smaller meetings since the last meeting that talked about TAC assessment results, was there?
Well, I felt like the review of the TAC assessment was very comprehensive and a lot to wade through. I felt like they were waiting for direction from us to pick a few things that are our type priorities so that they could then morph that into the final plan. Is that accurate?
Yep.
So I don't know, perhaps like as a group, we could discuss what a few of those might be so that we can give Jana direction to move forward with the consultant.
Yeah, that would be great.
Julie, do you have anything you want to read us in?
Yeah, just with our conversations with TAC, phase one was sort of the research of the needs of the state by looking at other studies that were done and looking at programs and things like that. So they're kind of on hold and waiting for us now. If we can find priorities, they would help do phase two, which would be sort of building a plan and objectives with some measurable goals for the commission. So they're kind of just waiting on us as a group to discuss what we think that might be. If we wanted to set a couple priority areas, like Veronica said, by the information that was provided.
Well, I find in some of these situations, we're at a big public meeting and trying to, without an outline or without all the background material in front of us and shared and thought of beforehand. It really is better maybe to have a small group like we did with the strategic planning and bring it back to the commission. So I'm kind of opening that whole question up to who we can put on that committee. Certainly, you'd be the point person on it.
Mm-hmm.
Scott did a nice job with this on strategic planning. I'm running into some time constraints in the next 90 days here, so I don't know that I can be on it, but my own personal schedule is such that it'd be hard to add to it. Anyone else? Would you be interested, Julie?
Yep.
What time frame are you looking at?
Our next meeting is in August, so it'd be nice between now and.
That's what I would say.
Yeah, so the contract goes through November, I believe.
Yep.
So to give them enough time for us to build those thoughts and then they can work on it and get it back. So then when the contract's finished out, they can finish out that work. That'd be good.
If I'm not mistaken, some of the comments from TAC 2 was there wasn't a lot of agency buy-in or participation compared to previous work with other states, and so it does put a lot on the commission to figure that out based on their assessment. I mean, bless you.
Do we have a representative from the Department of Human Services on the commission? I'm just blanking on all of our members.
Technically, there's a non-voting member, which would include the executive director or designee of Health and Human Services.
That might be a good member if we could ask just for that buy-in or the communication piece as we're looking at that. Might be a good idea.
Veronica, would you be interested in lending your wisdom to?
I'd be happy to participate if that's needed.
Well, it seemed to work well, Scott, last time when we had a group of about four of us or thereabouts.
Yep, I think so too.
Scheduling is always a difficulty.
Mm-hmm.
The more you have on but you also need the enough size to get people bringing their own participation, to have expertise to it. I like the idea of asking somebody from Human Services to do that. Is that something, Janet?
Do we know who that person is?
Send a text message to find out, but I don't know who that is off the top of my head.
Brittany?
I was going to say in the assessment, the key interviews were only with Department of Human Services. There wasn't interviews done with health. There wasn't interviews done with transportation. There weren't interviews done with rehab specifically. So if you want to tackle it all and pull out the information that they've looked at and maybe even use other studies, I think it would be important to at least acknowledge that those folks weren't directly interviewed for this assessment, and whether it's consumers of those services or agency reps or nonprofits that are familiar in those areas. Because not having transportation in the Olmstead plan, I think, would be devastating. I mean, that's a key feature of getting people out and into their own community and being able to live an operate. So if only focusing on the human services aspect or just even the paper plan without further consultation and I guess projecting the information might limit what you guys are able to do.
So Brenda asked in the chat if a member of the advisory council can be a part of the subcommittee. I think that would probably be a good idea.
That would certainly be fine if we had advisory committee members on that side.
Jake, you want to be on our committee?
Well, that would be okay if one of us be on the committee. I think it would be helpful considering that a lot of the TAC information on the DOJ settlement and the MFP information really wasn't quite up to par, in my opinion. And it was either old or really, I don't think they understood what we've done or the situation that we're in. So it was, I mean, I was personally very disappointed with the report, frankly. So I think that, I know we've got some time left on it. I don't know who should be a part of the committee, but I think it would be helpful for someone from aging or MFP to be a part of it to get the information accurate. Because there's no sense in building a strategic plan with information that isn't correct.
Right.
And Jake, because MFP changes so fast, it's
Yes.
really hard to have somebody that isn't actually doing it on a day-to-day basis.
I know, but it's not like they talked to us enough to get the information they needed to do what they were supposed to do. I mean, MFP paid for half of this study, and I regretted the money after I saw the report, just completely frank about it. And so.
So what I got from Sherry when she presented and when she answered some questions I had was that typically there was exponential state agency involvement where they got a lot of that information directly. And I too, I mean, I had 8 pages of notes on the study. There are a lot of basic services that were written incorrectly and how you access them. And somebody used this study to navigate our services in North Dakota, they'd be gone. It really wasn't spot on. So I think their ability to help build a plan is there, but not using the plan as the sole basis for information to find outcomes and goals, I don't know if it would be a safe thing.
Oh, Senator, you're muted.
There we go. Sorry about that. I would really appreciate it if those of you who had some concerns about the way this report has been done would send me an email about that. jlee@ndlegis.gov. Just tell me what you saw as the issues with it, so that, because I had to go enter the door, and so I missed the beginning of it, but I would like to have a message from you if you're willing to share what you saw as your concerns, because I want to know about that, please.
I think there are things that can be corrected, Senator Lee. It's just, they need to be.
Oh yeah, I'm okay with that. I mean, but I missed out in the beginning, and I don't want to. I'm coming in at the back of the plane, you know. I would just like to hear the beginning. Thanks.
Okay, well, let's create that committee and set it up. Would you mind, Jana, being the quarterback in that, or the chair?
For sure.
And work with schedules.
Can you say who's on the committee again?
Well, I have me, Scott, Julie for sure. Brenda from the advisory committee is interested. Veronica, you were if needed. And then somebody from MFP. Are you volunteering, Kayla, Jake, or do you want to be part of that?
I better not volunteer Kayla for anything.
You said good with that this month, and we're only 10 days in.
I'll let Kayla volunteer herself.
Can I get back to you, Jana? Can I just, maybe there's some other interest in our team as a whole that would also could maybe be a good representation. So it will be one of somebody from MFP, whether it be myself, Jake, or another team member.
That sounds good. Thank you.
Yeah.
So it's a yes, it's just not who.
Sure.
Housing was brought up a lot. Would there maybe be interest in someone from housing?
Cheryl Merck be a good one to have on that probably.
Or Jen.
Or Jen. Yeah, sorry, Jen.
She's got her hand up.
Hand raised. I'd like to volunteer somebody from North Dakota Housing Finance Agency to be on the committee. Dave Flora, our executive director, might have an interest in it, or myself. So we'll just kind of talk, or else we'll tag team on that. But definitely representation from our agency would be greatly appreciated.
For sure. Okay.
Yeah, thank you for volunteering. Appreciate it.
Not to volunteer people, but I think Carlotta usually volunteers for almost all the committees too, and has a very good perspective. That's a volunteer, Carlotta, because she's not here, but she usually volunteers for almost all the committees.
So that being said, with keeping numbers in mind, that we're up to 6.
You could always remove me. I could be as needed too, if you want.
So, Scott, Jana, question mark, Julie, question mark, Veronica, Brenda, Jake, or Kayla, and then somebody from Housing Finance.
You may find it takes 2 or 3 meetings, and so that if you don't get everybody at each meeting, if you have 6, it's probably all right.
Sure. Yep. So that would leave us at 6 right now.
And I agree, like 6 or 7 might be getting to an unmanageable number, but at the same time, I think it is important to have a good amount of Olmstead Commission members as well as people with different perspectives, because we wouldn't want a Olmstead plan that's, for instance, just looking at housing or just looking at transportation. We want something that covers our bases.
And across the lifespan. DPI.
Well, if we're talking about committees, kind of going back to this item you started with, the inquiry process, I felt like we had a pretty heavy discussion about what should that really be last time, but we didn't really, at our last meeting, but we didn't really come to any sort of consensus. But we did talk about the need for developing parameters or ideas and, you know, managing expectations if somebody brings an issue to us. So is that something that we should also like think about doing as part of committee work? Or is that something we can just kind of take it as it comes, or?
I think that we at least need to have a definition of what an appropriate inquiry would be for someone who's interested in making that. So is it an individual, I know just from watching last time, like Medicaid denial or something like that, like I in my opinion, feel like it should sort of be a chain of command thing before you bring it to the Olmstead Commission, making sure you've crossed all the bridges that you should cross as far as appeal processes and things.
That's a good point. If they've got any agency or administrative review process.
I think they froze.
Sounds that way. Does sound like that.
Don't talk about it.
But another thing too, is sometimes.
Just a second, Trevor, we're trying to get connection back.
I'm sorry.
I don't know how to fix that.
Yeah, you guys are good to go now. We can hear you, and you guys are moving around again.
Okay.
Oh, good.
Okay.
Stop talking about him.
I think they froze.
Scott, we heard everything, so cancel MFP
All right.
on the committee.
Yeah.
Trevor, if you wanna.
Another thing is, you just wanna make it easy for them, cause sometimes the department, when they do have an inquiry, they don't have actual policy, set out, so it's kind of hard and difficult to go to hearing and stuff, because it's not written policy, so you just want to keep that in mind.
What's the end game? Like, what do you see in inquiry that does meet whatever criteria is established that the Olmstead Commission itself would do for an individual or an entity?
You know, I think we have explored this before, and this one, I think we could tie up fairly quickly. Because that was one of the first things we ever looked at too, is how are we going to handle complaints or do those things. But it's going to take just a little bit of historical look at it. And with the 7 points that we felt that we could address, we can match those up. I just like, you know, if I had the time right now, I'd be glad to help on that. I'm just struggling right now on schedule. But I could certainly check with you on this, Jana, on a couple of the areas that I based on the inquiry, because I unless there's this thought that we maybe you'd have some thoughts, Veronica, on what that inquiry needs to look at. I mean, we've talked about this in the past.
Well, I feel like we've talked about it a lot, actually. But I think depending on who you ask, it always seems like every time we get an inquiry, we're like, oh, what should we do with this? So I just wondered if we could put some sort of formalized process into place that kind of states like how we handle an inquiry, or, you know, have all the administrative remedies with that, whatever organization the inquiry might be about, been exhausted, those types of things, because I guess I'm specifically thinking like, we don't want somebody to come to us when they haven't done step one and trying to get their problem resolved with, say, the Department of Human Services or their local school or a business or things like that, because I would worry about duplication of services, and we only have one FTE to do our work, so I would prefer not to have her spinning her wheels with something that's not really in our purview. Does that make sense?
It does, and I think we were very close to buttoning that down, and so you're right, maybe we just need a chart that says here's what that button down process looks like.
And if you've got something that's DOJ level, Olmstead level, what would the commission do? Or would it be referring it to P&A or what would the commission actually do besides that?
I was gonna ask that too, as far as if we're seeing trends in people complaining about the same thing, that would then be more of a DOJ type information or investigation. So basically, what's our role is the big question.
Well, I would like to suggest that we don't start out by talking to the big guns first. I mean, there's a process here that's supposed to be in place, and we're not even supposed to see anything that hasn't already come through the P&A door. That's where the first stop is supposed to be, not the public coming and making comments in our Olmstead meeting. But if there's a member of the public who has a concern, a citizen of North Dakota, or a resident of North Dakota, they should be going to P&A. And if P&A can't help resolve it and can't find a solution, then it can be brought forward to the Olmstead Commission for further review. I certainly don't think that the next best step, without a whole lot of thought, is to move to DOJ, because that is just an insufferable process. So let's just try to figure out how we can solve our own problems in our own way. We talk a lot more to each other in North Dakota than other places, that it means that we usually can solve our problems a little faster too.
And there's a large population that P&A doesn't serve by mandate to, the aging, non-disabled, or others that are, there's a large population that is, but there's going to be a small subset. You have vulnerable adults that does the abuse, neglect, exploitation part that P&A doesn't necessarily. So there are gaps.
But if we get those kinds of calls,
we
have memorandums with them so that we connect with CPS or VAPS or whoever.
That. So it doesn't, that's what I was asking, is it doesn't make sense to recreate the wheel and have one person or a commission duplicate what's already mandated by other agencies or entities, unless the complaint is with that agency or entity, of course, maybe, I don't know. But then again, what is the commission actually going to do?
My point is that protection and advocacy is there for everybody. I can't imagine that there's any entity or person that isn't, wouldn't be able to tell protection and advocacy about a problem that they might have. And unless my memory is totally shot, and I don't think so, when we set this up a few years ago, that's the door that has to be knocked on before anybody comes through it to talk to the Olmstead Commission. Not anyplace else. CPS is ultimately going to go to the courts, or it's going to go into the human service zones for family directed services. And so that's not the same thing. And so there are all kinds of areas where people can go if they have an issue. But no, let's not make this more complicated than it's intended to be. This is not intended to be a full-time job for us, only for Janet.
There's also the systems part. Without data and reporting from agencies, patterns, that's what's, I mean, that's what rises to an Olmstead complaint. Yes, it's one person and one person starts the ripple. But there are numerous concerns that have been expressed by people at this table, by reports, by consumers across the board. And those concerns may get addressed on an individual level to some extent through all these different methodologies. But it's the patterns which would rise to a complaint or which would rise to needing to be intervened in. And
But the
without
bottom line
data,
is, we don't have a power to intervene.
yeah,
The only thing we could do is say, we observed this, and if the commission said, we all support this is a problem, that gets sent to the governor's office
Yeah, I mean,
as a report. I mean, we can't say, oh, we're gonna fix your problem. All we can say is, we've gotten 10 of these from this organization, at least, again, my vision. And then we invite those organizations in to say, here's the issues that have been brought to us. Maybe not just one, but it's 5 times, 10 times. Please address that. And if you can't, we're gonna say, well, we tried to come to you, we didn't get satisfaction. Human services, transit, whoever. And then we're gonna say, look, we think that's a problem. And I know the center doesn't like DOJ, but that's the setup in the long run. If Olmstead Commission says this is a problem and the state doesn't fix it, next time they swoop in, they're gonna say, wow, you were even told this was a problem and you didn't fix it. You know,
I
that's
get
that's
that.
really a
Mark, but
long game.
you don't tell the superintendent of the school when your kid has a problem that probably could be addressed by the second grade teacher. You work your way up the food chain is my point here. You know, I think we're getting a little carried away.
Well, I agree. That's why I'm saying you gotta have more than one. You know, you can't just try and fix the second grader. You know, we have to have more than that.
You know what I really
10
want?
times from
I
one
want
school.
all of you people who are talking who do not have your video on to identify yourself, please, when you start talking, because I have no idea who's talking. I'm looking at 2 other faces besides my own on this screen, and so I have no idea who's talking.
Okay, it's Judge Romani, Senator.
Thank you.
I was the
Thank
one who
you.
was just talking.
Thank you.
And so,
Thanks for that request, because it's important.
yeah.
well, this is Veronica. I'd be willing to sit down with Jana and try and outline, you know, a process that is reasonable for how we deal with these situations, and then we can maybe share that out to the group for input if that's something that would be helpful.
It certainly would be, I'd be glad to take a look at whatever you're doing at the time, because much like the judges mentioned here, we struggled with that originally, and we realized we couldn't adjudicate anything. That wasn't our role. We can advocate, we can lobby, and we can go to the people that we think can make changes in the state. And I agree with the first person is not DOJ. That would be something that there was a serious systemic problem that nobody was addressing.
I don't even think we would go there. We would just submit to the governor. Yeah, I agree.
what about the inReach?
But since we've been there, and if we haven't buttoned that down so the world knows that's how we feel, we've got to, we just have to do that. So if you don't mind, I mean, I think even going through the minutes and some of our strategic planning, it's there to just say, okay.
Well, and I think overall, like, we might have differing opinions about how to do things, but I think we want to resolve situations at the lowest level possible. And I think we understand that we don't have any, we don't have a lot of teeth in our executive order for the Olmstead Commission to force somebody to do something, so that our power really, I feel, stands with our reputation as a commission and the power to advocate and educate on what the Olmstead decision is and how people can use that, so.
And we do have particular access certainly with Ryan being direct counsel for the governor, and the governor, we're the governor's commission. I mean, we're the ones appointed, he's the one appointing us. So we do have that ability to bring it right to the top official in our state if need be, and that's where we would start.
So this is Ryan. The executive order states that the Olmstead Commission has an advisory and oversight role. And I've only been on the commission for a year, but who is the commission advising? I think it's back to your question too, Judge. Like, and who are we overseeing? The commission is not really overseeing DHHS at all, or DPI, or DOT, any of those. Is the, I kind of defer to those who have been around this longer than I. What was that advisory role supposed to be? Is that strictly to the governor, to the agencies, to the legislators, to the judiciary? You've got all those people at the table here.
Yeah, no, I think it took us a while, because at first we were looking at maybe actually looking at litigation and all kinds of things. If somebody brought a complaint to us, what would we decide for them? And then we realized we didn't have the team, and that wasn't what the aegis of our assignment was either. So keeping within basically our constitution. So you're looking at that as good as what years of experience.
Okay.
Because that's something we go back at too, saying, based on our charter, which is the executive order creating us.
Or did the senator first?
Yeah, I was just going to say that, this is Scott, by the way. I think that there is always an aspect within public policy of the light of day shining some light and some sanitizing. And so at times there is a good place, because we see trends and we have conversations and we talk. I think the advisory part ultimately does go to advising the executive, because that's who appoints us. So we serve in that role to do that. So I think that, that's one of the key aspects of what this committee should be, is to be advising to the governor, so.
Senator Lee, your hand's up.
Sorry.
Brittany.
I was just ask, I know that. This is Brittany Hansen. I was gonna ask, with all the diving that was done earlier with bringing TAC in and whatnot, was there a discussion from those committees brought back to the whole commission as to, I don't recall it from meeting minutes from videos, but about what other states look like and do in those setups and how that advisory looks? And it's kind of more often than not that the agencies provide information to the commission is able to look in reach, in a sense, look for patterns, look for stuff, versus just relying on numbers of individual complaints. And so it's an effort that North Dakota is definitely lagging in as far as data, but documenting things, what agencies say compared to what the recipients of services say, and looking for patterns and problems to mitigate them before you get to a level of an Olmstead violation or a complaint. But then if it would, then the referral to the governor's office or another entity that would take on litigating something if it needed that, if it got to that where there couldn't be responses to fix it in the interim. I mean, because ideally that's, and it's not that you need a lawsuit, it's to fix the problems, to have everybody where they're supposed to be and integrated how they want to be. But it's not, from my point of view as parent and consumer, is that it's never going to get there if it's not collaboration. And there's clearly not a lot of interagency collaboration. There's hardly ever the whole person that comes to a meeting. And there's definitely not, there could have been a lot better input for the study that was supposed to help build this plan as a whole. To be not as blunt as I could be, but try to be blunt.
I think just moving forward, I'm happy to look at the minutes of what's been discussed and then present those to Veronica or work with you and then come back as a whole and go over it.
Yeah, let's try and draft something up for the group to review for the next meeting. And if people have thoughts on what this process should look like, maybe you can just share them with us and we will try and make it inclusive of everybody's ideas where we can.
Well, yeah, I think that'd be the process that we should proceed on and know that we just want to button that down.
So the subcommittee will be focusing just on the strategic, I shouldn't say just, on the strategic planning and feedback for TAC to further that process.
And they could be asked to, this is Julie, on when making plans with other states, what that looks like, the second portion, to answer some of those questions, what's other states' processes, so they could be looped into for some feedback.
Yeah, I know, and we had Dan working with other states in the past, you know, and asking questions of them, so it's, some of that's within the notes and the minutes and things as well too, so it's not been, it's been done, you know, and I know they worked with Minnesota pretty closely and brought those things back. So if you want to wrap that into the planning, we can do that, you know, and hopefully you can lean into Dan as well.
And if I recall from talking to him, it sounded like other states that do have Olmstead commissions, which aren't that many, are very much in the same boat as us of figuring out our role or those types of things. Not that we can't look at it and see if there's something that would be helpful to our group.
Yeah, and that was, rather than creating everything all over again, that was what we had him doing, is looking, you know, and if there's a network and a grouping of these Olmstead administrators, see if you can be part of it.
There is a group that meets, it's the National Olmstead Leaders, so from obviously around the country, and the meeting just happens to be next week. So I have been invited to be a part of that.
Well, that's a good place to start.
Yeah.
Is that whereabouts? Is that being held?
It's virtual because people, the gal that sent the invite is from West Virginia. So I'm not sure which states all participate, but.
And maybe out of that, you can get, if they have inquiry processes and things like that.
Sure, yeah.
You don't have to recreate the wheels.
Yep.
Can I ask some with all the projects, and where did the people with the disability, where are they? Because, like Brittany said, like, it's all on you guys, but I didn't say deal with her. It's on the people with disability parent of, they need to stop helping you guys more, because you guys cannot do it by yourself. I don't expect you guys to do it, but I do expect the disabilities to help. I mean, and I do strongly expect the parent also, because the parents go put in a program. No, but that is you need to help, cause you guys don't know what they need. So, I really don't want you guys to say, I really don't want you to say it's all on the advisor. It's not, it's on me, it's on the parent. If the parent don't want to come, that's their priority, but they cannot expect you to take care of it. We need to work together, So I want to say I'm for you guys, but I want you to say, hey, I'm going to help you guys, but I need you to be at the table. Don't come and tell me, oh, what are you going to do? You at the table, speak up.
Maybe in response to your comment, Cheryl, I would suggest that if we're going to have this advisory council, we kind of decide what role we want them to play. So if we want to give them special assignments or ask them to be active in committee work or help with the TAC plan or what have you, like maybe we can think about how we want to make sure we're incorporating everyone's voice.
Well, and this is Ryan again. We had talked at the last meeting about even incorporating the advisory council as a way to help triage maybe some of the inquiry requests, because it might spur, if we have an individual request here, but that's a lived experience, but from somebody on our advisory council, then we might be onto something more there that we can work on there. But yeah, I think that's a good idea too, Veronica, incorporating them more.
So, to Cheryl's point, I'm listening and reading and going back and over things. Cheryl had a lot of it on the head. It's lifespan and it's cross disability. And we're not going to have a plan that meets the needs of North Dakotans if it doesn't take into account the disparities as well as the diversity in services and in receipt of services and meeting needs of everybody that way. And I think you'll find when you do your dives, the states that are active meet monthly. The states that have significant DOJ settlements are the ones that have pretty rocking Olmstead plans. And because they had some good motivation, we have some good motivation. We just don't have a lot of action.
But I think if we all work together and not only depend on them, like we depend on them, we should all be at the table with you guys. Because you guys are talking about our life. And we should have an input how we see it for ourselves and for the next generation to come.
And it's very
and the parent needs, I'm for parents. I'm really am, because they had a hard time, the path. But I think also now they need to take on the past parent to fight and perceive the fight, still keep on fighting. And so that's how I think we should be as a team.
We have an advisory person who's not here because they're the caretaker for an individual who's struggling and encountering medical difficulties today. We have a parent who's here of an adult child who wouldn't be able to work otherwise. I don't often have staff I need to be here. I have 4 people helping with 2 kids today to be able to be here. The need is far more than what's presented at agency meetings. And the need is far more than what's usually surface level discussions at these meetings. And so the plan doesn't have to be detailed because most plans are not, but it does need to meet the needs of North Dakotans. And you're not going to get those needs unless you're actually digging deep to the people who can express them.
on a couple of the action items by appointing the two various committees here, but what is the next thing, Jana, that you'd like to go? Is it?
I think we covered 5 and 6 on the agenda, so just the next meeting dates through 2023, we have August 9th and then November 8th have already been scheduled, and that they'll both be here.
Here in this room.
Here in this room, yep.
I think it's very important to continue the in-person and the virtual, I think. Just for people.
What dates were those, Jenna? You said August 8th, and what was the other one?
August 9th and November 8th. They should both be
November.
Wednesdays.
Yep, perfect.
Do you have Jake and others, or do they want to make any comment or presentation?
The state folks, aging services, is going to be with us next time in the August meeting. I think Nancy Nicholas Myers will be here to give an update about that, and then that's all I've got so far for August.
Well, there's plenty of time
Yeah.
to build it. Yeah. Typically, this is the part of the meeting that we opened it to public comment, but I think we've had a pretty good interplay. But if there's other public comment, sure, open it up and welcome it at this point. I appreciate the desire to dive a little deeper into the planning, and hopefully we'll get that done and back to you at the next meeting.
Jake, did you have something?
I did. I think that it's important for the Olmstead Commission to hear about the fact that we're DHHS is cooperating with our public housing authorities, the North Dakota Housing Finance, around a services and housing supports team and committee, and we're trying to really look at partnering services with the housing world so that, as Senator Lee knows, we got $13.75 million for the HIF fund. That's awesome. I think originally the first request was like 250 million. So over 5 years or 5 biennia, but it's one piece, but trying to make sure that we are looking at housing for all populations that the department serves, whether it's a family or an elder or someone with a physical disability or someone with a behavioral health or developmental disability. Housing comes into play. Can't provide many services without a place to live, and we can't sustain housing if we don't have good supports to help people maintain tenancy. So that committee is going to be working on that over the next, we've been working since 2013, but we are sort of reorganizing after this last couple of years of not meeting. There's a lot of the works that's already been done, including with consultants. So it might be worthwhile that you guys are aware of that and even participate if you're interested.
I have a comment, Jake, on that. I think housing is going to be a major issue in the next 2-3 years, because getting on the housing voucher, and then when you try to find something especially accessible, it's nearly impossible.
That's exactly right, Trevor. And I know that Jennifer could probably talk to us about the study that's being planned, Jen. You want to talk about it?
Yeah, sure. Thanks for setting that up for me. So there was 2 studies related to housing that were proposed and accepted during this last session. The first one is HCR 3030, which is meant to study kind of the effectiveness of the North Dakota Rent Help Program. Since that federal program, those dollars are going to be done, I believe by 2024, but there is a chance that it's going to be done earlier than that based on the amount of money going out on a monthly basis currently. Also, it'll study homelessness and barriers to housing. So, you know, the next step for it is the Legislative Management Committee, which I believe meets sometime here in May, and maybe Senator Lee can confirm that to me, but they will make their selection of studies. And if there's any way for you to reach out to that committee to share your support in that study, that would be great. The other study that was passed and is, you know, in proposal is SCR 4016, which is a study on the housing that exists for individuals with physical disabilities. So again, that is a very important study to just really address how many units are accessible in our state and where can we make improvements. So that's all I have to add for that.
Yeah, I think Trevor's point about accessible units is a really critical one. We've often seen or experienced people having a difficult time, even once they get a voucher, to find an affordable unit, let alone one that's has accessibility features. So I think that study is going to be really crucial, but you're right on the money, Trevor.
Even elevators, even,
Yep.
you know.
Yes.
Do
Yes.
they have the proper doors? I don't know.
I think part of the problem is the definition of accessible is not well known unless you need it. So some education with housing builders, architects, providers, everybody.
Jenna, what's nice is that Jennifer and her team at Housing Finance, when they built their allocation plans for the federal and the HIF funds, they really build in accurate accessibility requirements if they want higher points. And so those buildings are coming with real accessible units. It's just that, you know, we're targeting, you know, 25% or less of those units, you know, so that we're not building new institutions. Which is really something that the Department of Justice talks a great deal about, you know, when they take a look at properties around the state that are, you know, 95% someone with a disability, even though people want to live there, there's service providers in the building, but it is basically building another institution. So Jen's team has done a fantastic job with responding to that kind of request that we've made through our MFP housing facilitation work and active involvement with their AP and open meetings. Jen, I don't know if you want to talk more about that.
You know, I'll just mention that, yeah, we do have scoring criteria in all of our plans that create universally designed units is what we've called them. And it is using points that or features that MFP housing had provided to us to incorporate much more than what accessibility requirements are under building code, fair housing, or any of those other programs. What really will be meaningful is in that study, if that is accepted for the units for disabled units, for physical accessibility, I think it's going to be very important that, you know, the study is going to recognize that building code and other regulations do not require true accessibility standards. And so if we want to make meaningful change, we really have to do it in the private market to encourage and incentivize universally designed units to be created with any new construction, and that you know, can be advocated at the city level. The other thing that I think is going to be important, and I know that as part of the Department of Justice settlement agreement, is an identification of funding sources available for environmental modifications, which would include adding accessibility to housing units. And I really think that those types of programs are really important because it gives individuals the choice of where they'd like to move and then modify that apartment to be suitable for them. And I think we really need to continue to look at that Our agency does fund a rehab accessibility program, which provides small grants to do that work, but it's only a maximum of $5,000. It's funded out of our capital reserves, and so we're limited in what we can do there, but we do try to partner with other programs to do that work. But I think it's going to be really important to continue to support those types of programs, and I think that, you know, next session it should be considered if that study has any good information for the legislators. So thanks.
So I'm just
We could keep talking about, yeah, we could keep talking about housing a long time, you guys. That's why I think it's important that, you know, when we schedule that next collaborative meeting, you know, we'll make sure that you guys are aware of it. And if someone, I know Jana may want to participate in that process.
Yeah, for sure. Thank you.
Just
Jake,
one more thing on, oh, sorry. Just one more thing on like housing. We met with South Dakota, who's really trying to reach out to some of the building markets and talk about the 4 different features that really make a home adaptable easily, such as wide doorways, wide staircases, only a very small like entry level, like you only have to go up a few steps. I can't remember the percent grade, but she had these 4 very adaptable features that she was trying to say, like, if the housing market that's building houses could just do these 4 things, we could make any home pretty easily adapted. So more to come on that, but it was kind of some of the work we're doing in regards to housing modifications too. So just wanted to mention that.
Have you ever visited with Dan Madler with Beyond Shelter? They do a lot of building of affordable and accessible housing projects. They're based here in Fargo, but apartment
I'm on their board, Judy.
Oh, wonderful. Well, then we got an inside guy. That's terrific.
Yeah, and Dan does a nice job of working with housing finance to get, you know, to try to secure dollars for those buildings. And yeah, they're very cognizant of, you know, the needs of those folks that need an accessible unit. But yeah, those affordable housing developers are really good about putting those designs right into the building project.
Well, and they know about the low income housing tax credits and some of the things that are really appropriate for making sure that the rents can be affordable for people, you know, and they can sell those tax credits. So it's a pretty good deal.
It is a good deal, Senator Lee. And the problem is that even with the tax credit dollars going in, they're not affordable. You know, they're
because materials and labor isn't anymore.
Yeah, the rent's lower, but it's not necessarily low enough for someone living on SSI.
Right.
So they still need a voucher to live there in most cases.
And Jake, that's what I was going to ask you. You talked earlier about the 13 million plus allocation. Is that going into new units or just helping things be accessible?
We'll let Jennifer.
13 million doesn't go that far.
Jennifer?
I'll go ahead and speak to that. Yep. So the Housing Incentive Fund, this last session actually did add another eligible activity to the program in the single family development or rehab for communities 20,000 and below, or in partnership with a community land trust. So that is kind of one more chip off of the uses for the program. So we're going to have a portion of the funds set aside for that single family activity. A vast majority of the funds will be set aside for multifamily. It is for bricks and mortar primarily, so it's for either rehabilitation or new construction of affordable multifamily projects. Oftentimes HIF does go in as a gap filler in partnership with our other federal financing programs, the low income housing tax credits. We also administer the home program and the housing trust fund program. So HIF is usually just a part of those deals because it does take quite a bit to make a unit affordable, and we have to buy down the mortgage with those types of fundings. That said, the dollar amount that we received is a nice chunk. We are hopeful that we can make it last for 2 funding rounds. The allocation plan for HIF is published on our website at ndhfa.org under project financing. So you'll be able to find the 2023 approved plan out there and how it is ranking scoring our applications. We'll accept applications in September, review them, rank and score them, and then make our funding decisions in November. All of our combined funding sources that we get on an annual basis, primarily depending on if we have more rehab projects than new construction, but I usually say we can get another 250 units out of it, meaning new construction or rehab. Some years we get more because the rehab, there's larger projects like 182 units of rehab or something like that, but really an average is 250 units. So we barely scratch the surface of need. Our housing needs assessment, which is also published on our website, has a lot of great information about the need of additional housing units and the significant rehab needs that North Dakota has. And so we try to make sure that we are funding both types of projects. We know that 55 and older and accessible units are extremely important. So they do get scored high priority when projects do commit to that. But we also have a need for low income families too. So we really are trying our best to spread and meet all of the needs of North Dakota, but we have minimum funding sources.
Thank you.
Yep.
That's helpful.
If anybody has any questions related to our allocation plans, the housing needs assessment, any of that, I'm going to pop my email address into the chat. And for those of you who are in the room there, just go to the gal who's running the meeting and she'll give you my information.
We'll get it in the minutes for everyone.
Thanks.
Thank you, Jennifer. Any other input? Anybody here would like to make? Our scheduled time is till 4, so we've got a few minutes if there's anything else we want to.
Can I make sure that the call-in number gets put on the agenda for the next meeting for those who don't have Teams?
That we can do. Well, there's no rule to actually put in early, so we can accept the motion to adjourn.
So move.
Second. We can just move that. Yeah.
Well, once you say it's done, nobody can argue. That's what I always say.
Thank you, everybody who
Yep,
joined.
thanks, everybody.
Thank you.
Thank you. Yeah, I sent you out.
I will.
Did you guys have on call meeting today?
Okay,
Nice to meet you. I got an email from you and
Yeah.
been crazy, so I just didn't know when to see you here.
Yeah, get it.
Oh, yeah, we have
We'll
something
talk.
coming, right?
All right.
Did that get lined up for you?
Guys have a good week.
Okay, good.
See you.
Fargo staff, is going to come
You
to the
too.
Fargo meeting next week.
Yeah.
Talk about
Okay.
rates and unions.